time. Good morning, everyone. I'd like to call this Board of Supervisor meeting to order. The date is September 28th. The time is 9 o'clock. I'm going to ask everyone to please stand. I'm going to ask our Ag Commissioner, Kamal Bagri, to lead us in the Pledge of Allegiance, and then remain standing. Our Pastor Jim Applegate from the Redeemer Church will lead us in prayer.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Would you join me in prayer? Father, thanks that we get to come before you this morning. It's the first time I get to pray for this new set of supervisors, and I'm super thankful for them. We're super thankful for them representing our county and for the work that they're doing. Lots of needs in this season. It's difficult, but it's also, we're thankful for the needs. You said God blesses those who are poor and realize their need for him, for theirs is the kingdom of heaven. And so let our needs today just lead us to you. Pray for wisdom for these leaders and for the staff here. Pray for peace in our county. Amen.
Amen.
Thank you, Pastor. Thanks, Kamal. Okay, now we're going to move on to item number 3, presentation, Stanislaus County 2020 Ag Commissioners Report. Commissioner Bagri will be presenting. I do want to let everyone know that I have jury duty, and so at 9:45 I will be leaving. I'm sorry if it's in the middle of a conversation. Vice Chair Withrow will be taking over.
Good morning, Chair Chiesa, board members, CEO Hayes, County Council, and everybody in the audience. I am Kamal Bagri, the Agriculture Commissioner and Sealer of Weights and Measures, and I'm glad to be here to present our 2020 Agriculture Report. This year's report was dedicated, or is dedicated, to my predecessor and the Agriculture Commissioner who was here from 2013 till this year, Milton O'Hare. I had honor of working with Milton back in 2006 till 2015. He was a great mentor and great friend. He dedicated his whole life to public service. He started in 1982 with San Joaquin County as a pest detection trapper, a part-time job, and then he moved to Stanislaus County in 1999 as a deputy sealer. He became Ag Commissioner, or appointed as an Ag Commissioner, in 2013 and just retired this year in March. Milton had a passion for public service. His focus always has been serving the customers, and he instilled those values into our Agriculture Commissioner staff. He was big on technology. Actually, he led statewide programs for pesticide use enforcement, for permitting processes, and for the inspection processes. And those programs are actually being used statewide in California. So I just wanted to recognize Milton for his great public service and wish him luck for long, happy retirement. In this year's crop report, we are also highlighting our farm workers. Of course, everybody knows that the COVID really destroyed a lot of businesses last year. And through the pandemic, there were big impacts on the agriculture. As M.S. Swaminathan once said, if agriculture goes wrong, nothing else will have a chance to go right in the country. And we saw that last year as the store shelves emptied, and the news showed empty shelves in the stores with no fruit and vegetables, and the crops were left in the fields to be harvested. It became brutally apparent that how essential our first-line workers, farm workers, were, who play an important part in bringing the produce to our table. So we wanted to make sure that we recognize our farm workers And throughout the publication, if you would read, there are Farm Workers of the Year nominees which are highlighted, and those awards or those nominees were sponsored by our Farm Bureau, Modesto Rotary, and AgSafe. And we are hoping as we emerge from this pandemic that our society does not forget the importance of those who make the stages of farm to fork possible. And those people who actually work in acres, not in hours. So with me today, I have my staff members, Amy Lomeli and Carrie Boffman. They will be presenting the top 10 commodities of the last year and the programs of the Ag Commissioners. Amy?
Thank you, Kamal. Good morning. It's been our pleasure to compile these statistics for the department and to present them today. The 2020 grand total agricultural value for Stanislaus County is $3,476,093,000. Following statewide trends, this is a decrease of 3% from the 2019 value of $3.5 billion. Most of us would probably rather forget 2020, but this report reflects a pandemic year that changed markets suddenly, dramatically, and created numerous challenges along the entire production chain. As lockdown orders went into effect, customers changed eating habits as schools and restaurants closed. Additionally, after emerging from a dry winter, last summer dragged into a historic fire season that burned significant rangeland on the west side of our county and the SU Lightning Complex fire. Our late season brought little rain into mid-December, and a year later, many of these challenges are still plaguing our industry. Following tradition, I'll highlight our top valued commodities for 2020. Number 10 are tomatoes. Canning and fresh tomatoes combined came in at $38 million last year, decreasing because of fewer acres planted and the rotational nature of this crop. Number 9, turkeys. 2020's value was $54 million, also a decrease from the year before. Producers struggled to modify production for fewer gatherings and smaller birds for those that did gather during pandemic Thanksgivings. The poultry industry also suffered processing plant pandemic-related labor disruptions. Number 8 is almond pollination, valued at $89 million. Pollination increased from 2019 as a result of the increase in almond acreage. Number 7 is silage at $99 million. Value decreased from the year before as a result of less acreage overall. Fewer acres were planted as several dairies in our area closed, following a state and nationwide trend in the dairying industry. Number 6 is walnuts. They came in at $103 million, another decrease from the year before due to low prices and a stagnant market. Number 5, nursery, fruit and nut trees and vines decreased $12 million because of less acreage planted. Number 4 is cattle and calves. They increased $3 million, and like our silage value, this number is also influenced by dairies as cows are sold between operations or moved into the terminal market. Additionally, many beef herdsmen sold off significant amounts of cattle due to rangeland conditions over the last year. Number 3, chickens. They're valued at $342 million. Chicken value decreased 6% due to production fluctuation between counties, and like turkeys, COVID-related processing challenges. Number 2, milk values increased $108 million to $737 million. Producers benefited from the federal marketing order, excellence in genetics for production, and milk going to higher value products at local processors. And finally, to round out our top 10, our number 1 valued commodity continues to be almonds, despite a $105 million decrease. Producers saw a record-breaking crop, but lower prices than the all-time high several years ago. Overall, these remained fairly consistent from the prior year and are responsible for 86% of the gross agricultural value in our county. Kamal, would you like to introduce the next portion of our presentation?
Yes, thank you, Amy. So before we go into the department programs, I just wanted to highlight that a lot of people think that Agriculture Commissioner's Office only do enforcement activities. In last year's pandemic, I wanted to actually recognize my staff who distributed a lot of personal protective equipment to our farm workers, as well as the applicators for the pesticides when there was a lot of shortage of masks. We worked very closely with our state OES partners and brought all the PPE to Stanislaus County to provide it to our workers here. So as you can see from the numbers, these were huge numbers. We provided a lot of hand sanitizer, cloth mask, N95 masks, as well as gloves to our residents here. Also, one of our very important program is to get the product or the crop which is produced in Stanislaus County exported to other countries. As you can see, our staff issued over 10,000 export certificates, which are known as federal phytosanitary certificates, and with 108 trading partners. The top 5 importing countries were Republic of Korea, Japan, India, Turkey, and Germany. And the top commodities which were exported out of Stanislaus County were almonds, walnuts, and different kinds of seed. I'm going to have Kerry go over the departmental programs and highlight the work performed by the Ag Commissioner's staff.
Good morning, and thanks, Kamal. To expand on Kamal's highlights, the next few slides briefly cover some of the activities and benchmarks we achieved. Despite fewer face-to-face interactions and the majority of our staff working from home or strictly in the fields, maintaining our services and regulatory requirements. Our pest exclusion branch is responsible for preventing pests from establishing in non-infested areas. In addition to export certificates Kamal presented, inspectors walked nearly 1,500 nursery acres looking for disease and insects, and we inspected over 650 apiary shipments, checking marking requirements and for invasive pests. A new noxious weed program in 2020 resulted in 2,200 surveys conducted. Our pest detection seasonal staff placed and serviced over 52,000 traps for individual exotic pests like medfly, glassy-winged sharpshooter, Japanese beetle, and others. These programs place traps in specific host plants in hoping an invasive insect will be detected before they become established in our community. Fruits and vegetable sanitization inspected select produce at 100% of the contract packing and wholesale facilities, ensuring correct labeling, marketing, and maturity standards. This division regularly inspected the 3 certified farmers markets and maintained seasonal daily inspections of cantaloupe packers for compliance with the state marketing order for sugar content. Despite challenging social distancing mandates, pesticide use enforcement was able to conduct 595 inspections, ensuring safe and responsible use of pesticide handling and applications within the county. 324 of these were pre-application site inspections for restricted materials like fumigants to make sure the location was adequately prepared before applying the pesticide. We also assisted with 5 continuing education events, most of which were held online, and recycled over 62,000 pounds of pesticide containers. Weights and Measures inspected 85,000 weighing and measuring devices in 2020. These included everyday items such as fuel dispensers, counter scales, and water submeters, to more obscure ones like railway and meat weighing devices and all of the CHP wheel load weighers. This concludes our department highlights. Kamal, would you like to close it?
I would like to express my appreciation and thank you to all my staff, agriculture producers, industry representatives, and public agencies, along with UCCE, who provided all the figures for us and the data and the articles for this report. Additionally, the Ag Commissioner staff, who specifically worked on compiling these numbers and bringing this information to all of us. As we recover from the pandemic and pray for the rain this winter, it is apparent that there will be changes in the market, and we are hoping that we next year bring good news for our farmers and ranchers in our country. I would like to take any questions at this time.
Yeah, thank you. Any questions, comments? Yeah.
Just quick comment. First, Kamal, congratulations on your first report here. Good to see you here and happy to have you do this. And thank you, Amy and Carrie, also, and your entire staff for all you're doing. These are always fun times. We always wait for this report each year, and it's it's crucial to our economy here. Everything that ag does is just, our number one industry, and we're so dependent on it. And then we're so dependent on the weather as things go and the prices. So hopefully as prices come up as they are right now, things are going to get better. The thing I always like to remind, I think Vito does too always, is we talk about these numbers, $3.476 billion, but that's gross, not net. It's not the net profit that the farmer's making, unfortunately. And farming costs continue to go through the roof, continue to rise, and with all the different regulation and stuff that we're up against here in California. So this is, like, again, we love to emphasize this is our number one industry and how crucial it is to our economy here in Stanislaus County. Thank you guys so much for all you're doing, and next year's numbers will be bigger.
Yes,
Will be
thank you,
increases. Thank you.
Other comments? So, thank you very much. Again, congratulations on your first one. I so much appreciate the acknowledgement of the farm workers, because our ag industry doesn't exist without them. I think it's extremely important. Also, the fact that you guys are participating for a Farm Worker of the Year. I think that's great, acknowledging someone who's gone above and beyond, or people, it could be plural, who've gone above and beyond, and then to acknowledging Milton O'Hare's contribution for many, many years, not just as our ag commissioner, but working his way through the step-by-step through different positions. He really set us up in a good spot, and I know, Kamal, you're very appreciative of all the things that he's done with you. And so, going back to what Supervisor Withrow had said, there's the initial $3.5 billion, but there's the multiplier effect. We look at our major manufacturing employers, and I believe 8 of the top 10 are still ag-based. So we're still an ag-based economy. It is extremely important to employment in this county, and will continue to be. Even if we expand and diversify our economy, it's still going to be the base of our economy for quite some time in the future. The commodity prices, I believe, this year are up because of the drought generally, and we do have some irrigation districts here that have planned correctly. Oakdale, Modesto, Turlock Irrigation District, CCID has solid water rights. So we've got, we're always going to do a little better, even in a drought situation, I believe, into the future. So that's just great. And thanks to Tom at the Farm Bureau and Wayne for your contribution in making sure that ag continues to be a priority in this county. So with that, if there's no other questions, I think we are just, we don't have to receive the report. It's just a presentation. So thank you very much for coming in.
Thank you. Thank you.
It's great. We'll move on to item 4, which is an update related to the 2019 novel coronavirus COVID-19 emergency and the essential services in Stanislaus County. CEO Hayes.
Good morning, everybody. I'm going to go ahead and just pitch right over to Mary Ann Lilly, our Health Services Agency Director, and Chelsea Donahue, one of our amazing epidemiologists that works at the Health Services Agency. Thank you for joining us this morning, Chelsea.
Thank you. Chelsea's going to start with our slides this morning.
Good morning, everyone. So we're just going to start the presentation off with a quick update on where our COVID-19 cases are and some of the trends we've been seeing over the recent weeks. So as you can see, over the past couple weeks, this is cases by episode date. We have started to see a decline in cases. When we compare to what we saw during the winter surge, the cases are at a lower level, but we're definitely continuing to watch these cases to see if this is a trend that's going to continue. So these are the cases displayed as that daily case rate, so the 7-day average with a 7-day lag for 100,000 residents. As of yesterday, our case rate was 33.4. So again, you can see that declining slope, which is an encouraging trend. So we're definitely hoping that that continues due to like all the efforts of the community, masking, social distancing, and of course the vaccination efforts that are happening. Testing positivity. Similarly, there has been a decline over the past couple of weeks. Recently, that number has stabilized slightly, but we are still on that declining slope of testing positivity. The other thing to note is their testing volume. So currently, we're averaging around 517 tests per 100,000 residents a day. This is a little interesting when we're comparing to our previous summer surge, and that these numbers are actually very similar to the testing volume that was happening during our winter surge. So COVID hospitalizations and ICU, confirmed ICU, COVID-19 confirmed ICU patients. We are also starting to see a decline in these hospitalizations as we see our cases declining, which is, again, another encouraging trend. So COVID-19 deaths, this data can tend to lag a little bit as we wait for deaths to be reported. We can see a decrease over the past couple of weeks, although we can see that there was 1 week, during August where we had close to 40 residents die in 1 week. So for this message, it is something when we're looking at how our community is impacted, knowing that there is still risk for severe illness with COVID-19. So the last trend we're going to overview as far as cases go is this case rate comparing fully vaccinated residents to not fully vaccinated residents. And we have seen throughout the surge that the highest peak was among our not fully vaccinated residents. Similarly, when we're looking at hospitalizations and deaths, a majority of our hospitalizations and deaths are still among not fully vaccinated residents. So that leads us into Mary Ann's section where we'll be talking about vaccinations.
Okay. We're going to give you a little bit of an update on where we are and touch on the boosters that you're hearing a lot about in the news. This slide is to convey that vaccinations are still continuing. We continue to vaccinate, and there are folks that are still reaching out to get vaccinated, so that's good. The next slide, the next three slides, I don't think we've brought these to you for a while, so thought we would give you this update. This is the look of the first, the at least one or fully vaccinated population by age band in our community. The next slide shows you the breakdown by race and ethnicity. The higher performing bars that you see there are smaller parts of our population. You can see the larger portions of our population are all tracking at about the same place. And then next is to show it to you by city. Patterson continues to be our highest vaccinated city, but all doing pretty well, and all with at least one dose, over 50%. Not where we need to be, but making progress. And then to move on to the booster doses, and that's to increase immunity that may have waned over time. This first slide is something that Dr. Weishampyan showed you last week, but I thought I'd start there just to give the context that we don't really know what the optimal level of antibodies for protection is. We do know that there is often with vaccines waning after 6 to 12 months after the vaccination. From the studies that have been reviewed, there does seem to be some small decrease in protection against symptomatic disease. And as Dr. V had pointed out, whether that's waning immunity, whether that's the Delta variant or a combination, we are seeing some small decrease in protection. And we know that a booster dose does clearly increases antibodies. This is an update from what was shared last week. we had conveyed that the process, the pretty rigorous process that goes forward in the country, both the federal and the state level, at looking at vaccines continued after the meeting last Tuesday. It went through all of these steps as really kind of a chronological order and completed last Friday, the 24th, which then made the booster dose approved, available, recommended across the country. I would say that there was not complete consistency throughout some of the proceeding, and so it was difficult for really for all providers to know exactly where it was going to land on Friday, which may have caused some confusion over the weekend because we really needed some time to implement and get good communication out. So I'm going to just go through kind of an overview of what was approved. So at this point, we're only talking about the Pfizer vaccine. We understand that Moderna and Johnson & Johnson will probably follow soon, but they're not through this process right now. So when we're talking about boosters and what's approved, it really only has to do with Pfizer and those that received Pfizer initially. So let's go to the eligibility slide. So it's not just open to all that had Pfizer. First, you have to have completed the 2-dose Pfizer series, and the series needed to be completed at least 6 months ago, and must be at least 18 years old. Then there was some kind of debated as to who should get the vaccine, in part, as I understand, based on the studies, the science, and what is anticipated because of what they're seeing in those studies. So the CDC recommendation came out then as 2 categories: the should and the may. So should include people age 65 and older, residents in long-term care settings, and people age 50 to 64 with underlying medical conditions. And then the may, age 18 to 45 with underlying medical conditions, and people aged 18 to 64 that may be at increased risk due to an occupational or institutional setting. The CDC website, and we'll do more to get more communication out to the public on those categories. The CDC website, though, it's really easy. You go to CDC and the booster icon, and then it breaks down in a lot of detail what all of this means. In terms of underlying medical conditions, and this is not a complete list: cancer, chronic kidney disease, lung diseases, diabetes, heart conditions, the immunocompromised, pregnancy, overweight, and obesity, and there is more. Under the increased risk due to occupational or institutional setting, first responders, including and healthcare workers, educators, food and ag workers, corrections, public transit. There are some additional categories, and there's a note that may be updated as more is learned. So the one point too that I wanted to make, because this question has come up, do boosters change the definition of who's fully vaccinated? And it does not. Fully vaccinated is not counting a booster. It's the completion of the single or completion of the 2-dose series that have been approved. Okay, I just wanted to touch on, in terms of priority, there's no shortage of vaccine, and the booster is the same dose as the first and second, so it's not something different that you're getting, and there's no shortage. But there is some prioritizing, and that's partly why you saw the should and the may. So from our perspective and the CDC's perspective, the highest priority continues to be to get the unvaccinated vaccinated, because that's where you're going to see the biggest impact to ending this pandemic and the negative impacts of it. So while in our public health clinic and what you're seeing implemented through pharmacies and whatnot will be available based on what's authorized, our extra efforts are going to be in this order that you see. Okay, and again, you can see the My Turn system has been updated with regard to the Pfizer booster. Very easy to schedule a convenient location to get your vaccine. There's phone numbers there. as well if there's additional questions. And then next, there's we just want everyone to know there's a lot of information. If you have questions, if you're hearing confusing information, there is information out there that is readily accessible. Get to our website. We've shown you here on this slide the various ways to get to the Health Services Agency website, and we have links to other websites as well. We also we just updated our website, thinking that the way that's formatted may be a little bit easier to find what it is that you're looking for. Several weeks back, we implemented a newsletter that you can subscribe to. You go onto the website. If you have questions, you can enter into the website questions, and the next week's newsletter, we try to answer those questions. So we're really trying to make sure that if folks have concerns, hesitance, hearing confusing information, that there's a way to get the information and to reach out to us. And that concludes the presentation for this morning, and we'd be happy to try to answer any questions you have.
Okay, any questions of staff? No?
Just real quick, thanks, Mary Ann and Chelsea. Thank you, guys. I talked to Jody, we talked about this yesterday, and I'm just curious, it seems like we get to a point where we're up against a wall as far as vaccines. A certain amount of people just aren't going to get vaccines, and bless you. And so we're, but I wonder when someone, as we do the testing, and someone tests positive, do we have some sort of protocol in place? Okay, not that you've tested positive, go and quarantine yourself somewhere for 14 days, but more than that, like, it seems like we should have, like, okay, here's your kit, here's what you need to be doing, here's some various medications, here's different things you can do to try to keep you from getting to the point where you end up in the hospital. Do we have anything like that? Have we thought about doing anything like that? It just seems like it makes sense. If our biggest push is vaccines, and I get it, that's a good thing, but if we can't get past that, at least whenever somebody tests positive, what do we do besides just telling them to go home and quarantine, and hopefully they don't end up getting worse and going to hospital? Because I know there's various treatments that are out there, things that are proven that hopefully reduce hospitalizations. It just seems like it'd be a great idea if we somehow had something like that that said, okay, you're positive, here's what we're going to give you for right now, and then we'll hopefully keep you from ending up in the hospital.
Okay, I'll try to answer that. Since early in the pandemic, we have there's the order, but there's also guidance that we get to those that are positive. If we try multiple times to reach by phone, I'll get a text with a link to that information, so that if we are never successful, they don't want to talk with us, we try to make sure they have access to such information. I wish I had those numbers, but thousands of individuals we have spoken with, and we do try to make sure they have that information, the information they need to take care of themselves. But I do want to comment that we also respect sort of what our role in public health is and what the healthcare provider's role is. So we also will encourage them to be sure to reach out to their healthcare provider on a one-on-one basis in terms of what to do. The one piece of additional information, and we'll plan to bring more information back, the monoclonal antibody treatment. There's been some ongoing changes in what's available and what's recommended, and when, for who, but there really hasn't been enough access. There is currently a shortage of the monoclonal antibody treatments, but we hear from our state colleagues that's temporary, that should change. There's been a lot of work lately in working to increase access points within our community. The reason we didn't really go into it prepared today is that it is a work in progress. It looks like we may be up to 8 or 9 access points, but they're not fully implemented yet. And which patients would qualify for what may be different. So it's a work in progress, and we'll share more into the future. But we really are trying to meet what you're asking.
Yeah, that's perfect. It seems like, as we get, maybe we get another report next time you guys are here as far as how's that going and I know it has to be administered through physicians. It's not something that somebody can probably just do at home, especially with the monoclonal antibodies, that process. But it just seems like it would be, because I know we're going to get to a point where there's just people that aren't going to get vaccines, and that's their choice, that's fine. But then let's have something to keep people out of our hospitals. And if there's some way we would have a system in place, okay, here's what you got it, here's what you're going to start doing. We need to, I mean, again, we can't force anybody to do anything, but it'd be great if here's the locations where you could go. If you start to feel the symptoms of this, you could get in and keep people out of our hospitals and keep us, because there'll be another surge, there'll be another variant, it'll continue to happen. I just, who knows, maybe I'm wrong. But yeah, let's just, if we could start working at that end of it and to really keep the hospitalizations down, because I just think the vaccines, we're going to be to a point where we're done. There just aren't going to be any more people getting vaccines, and we've gotten past the easy part, and now let's just try to keep people out of hospitals. Anyway, okay, I know Jody wants to talk.
Yeah, if you don't mind, just a quick statement and then a question for clarification. The statement being that over this last year and a half, I myself have seen circumstances where individuals who had tested positive for COVID had gone to their personal physicians seeking treatment protocols and had been told that they didn't qualify for things such as monoclonal antibodies. However, when they did present to a physician who administers them, they did qualify and they did really well on those protocols. So it was frustrating to me that, it's very difficult, given the hundreds or thousands of physicians that we have in our community that may be actually directing this care, that they may not all have the same level of education and understanding of what the requirements are. So that's certainly something we can always seek to do. But the clarification I wanted to ask for Marianne was that in terms of when someone tests positive, having a kit or something like that, I just want to confirm that that any kind of medication or anything like that needs to be under someone's healthcare license, and that inevitably is going to be their personal physician is going to have to administer or write those prescriptions.
That's correct. Yeah, it wouldn't be public health's role to do that. It would be the patient's individual healthcare provider.
Okay. And Marianne, just a question for follow-up or further research. Does that also include things that are just considered supplements, uncontrolled substance, vitamins, things like that? Are you aware of any public health departments that are broadly distributing, uncontrolled substances like vitamins?
No, I'm not.
Okay. Just curious for follow-up in the future, but thank you very much. I know we put you a little bit on the spot here, but it was kind of a live conversation we were having yesterday. So.
Yeah, sorry, Marianne, but
That's
thank you
okay.
guys very much. Appreciate all you're doing.
Okay, all right, thank you.
Thank you. Okay, now we're going to move on to item 5, which is public comment period. It's an opportunity to speak on anything that is not on today's posted agenda. The board can't take any action on it. I'm going to ask you to please, if you can fill out a speaker card, you don't have to. I do have 3 speaker cards. I'm going to limit your comments to 5 minutes. And the first name we have is Deanna Washington.
Good morning.
Morning.
The first thing I want to say is I do want to commend you for the things that you're doing and the ways that you help us in the community. Yes, I know that we come at you and we say that you serve us, but it's not as simple as that. I know we would like to point that finger at you and say that, but we serve you also. And we have to be in the community fighting for the things that matter. We can't be scared about it. We have to get out there and do it. If you want better, you have to fight for it. And you have to do the work for it. Now, the first thing that I'd like to talk about is we have a family farm on Paradise. I realize that the traffic has gotten worse and worse. Here's my problem. We're the first farm coming off of 132 onto Paradise. And in that curve, we keep getting hit. Now, years ago, I fought for the bumps in the road, and I fought for the stop signs. Well, we've progressed to a different stage now. I'm asking for solar-powered lights. There was a time, I know, Mr. Withrow, I asked for a barricade like you would have at the river, like where the houses are. for safety. You told me you couldn't do that. If I asked for that, then everybody else would want that, and that would bankrupt our county. Okay, so where do we get to public safety? I can do everything I can do. Poles and cement, boulders, telephone poles, to make them skid outward and not into the fencing. I can do all of that, but still, each time I get creamed out there, I have my insurance coming down my neck. I don't want to end up with no insurance. And these are hit and run incidences. It's rarely that we're coming away with the information to prosecute someone or bring them to a level of responsibility of what they chose to do. Now, the traffic is getting worse. We also have a problem of police presence. My question to you is, when are we going to get relief out there? How long? I've been asking for this one thing for 3 years. How long do I have to wait for help out there? And then police presence. We are living in lawless times. We have people out there doing all kind of crazy stuff. And if we don't have police to help us with law and order and keeping that chaos down, we're in trouble. So I want to know, what are we doing to provide for having good police officers? And I mean officers that work with the community. And it's not just all on them, it's on us too. Now, in order to have that attitude starts from top to bottom. And I want to see our relationship improve. But we have to have the officers to be there to help us. Right now, we're having a really hard time in that area of that Spencer Colony, where Dan Millis Park is and that Spencer Colony. Do you have a plan for all these homeless? Because they're continually wanting to set up camps. It's not a crime to be poor. It's not a crime to have mental illness. However, it is not okay when you have people coming to piss in front of your property, throw garbage down, and act up. And if you don't have the police presence to help you, it's getting to be something. I'm a resident there. I've lived a lot of different places. I don't mind fighting for what needs to happen, but I can't be alone either. And I can't be the police, because that's going to be a problem. I have a lot of gumption and a lot of balls, and I'm not going to lay down for nobody, but that's going to be a problem. So I'm asking for some help here. And do we have a plan to combat some of these problems? I know we have a lot of stuff, but I'm saying I need your help now, because we have some issues that are brewing in that community that are going to go way left, especially as you're getting people that are having more evictions on them, people congregating in different areas, and our city is getting to be dirty everywhere I turn. Garbage everywhere. Homeless laying out in the streets of downtown. Do we have a plan to assist and help them so that we are not having problems that our residents do?
Thank you, Deanna.
Just real quick, Deanna, good to see you always. And you know, on the curves, there are just a couple things, you know, on the curves that we've actually gotten some grant money, I think, in Public Works, and there will be lights coming there as soon as we can. I know it's never soon enough, but we will have flashing lights, or that's the next thing we're going to try to improve that. So, and I think Public Works hopefully has let you know that that's coming. I know not soon enough, but we're working on making that happen. From the law enforcement side, you know that we're actually going to open up a substation here in a few months out there in Salida, which is going to provide 5 more deputies out in that area, which will free up and allow us to have, really will help the entire county, really, as far as additional deputies out there to help. So we hear you on that, very much so. And then on the homelessness thing, as you know, I know we've gotten a call recently for right out there around the corner from you, that there has been a group out there, and we're working on that, whether it's Modesto City's Heart Team to get out there. Enforcement side of it, we are working very hard on now to try to get these people off the streets and into services. So everything you're saying is true and valid, and we're doing everything we can to try to work on it. And then I appreciate you coming here.
Okay, thank you for your assistance.
Thank you, Deanna. Next up, we have Laura Estrella.
Good morning. My name's Laura Estrella. I've been a cardiac telemetry nurse at Memorial Medical Center for 12 years, and I was enthused to hear Mr. Withrow's question to Public Health about what do we do for patients who are recently diagnosed as positive, but before they have severe symptoms, because that's exactly what our whole presentation is. My comments are preliminary to the presentation of the brochure you all have on your desk that Ashley's going to cover with you. So at the last board meeting, one of our other colleagues, Karen Whitlow, spoke during public comment to address the question posed by Mr. Padrizio from Memorial. He said, what can we do to encourage more people to take the vaccine in our communities? And so Karen brought up a good point when she said that what needs to happen is more and better education. While it might be helpful to attempt to further educate the public by providing full and open disclosure regarding the pros and cons of COVID-19 vaccines, and to provide more accurate information about the actual emergency use authorization status of the COVID-19 vaccines and boosters, it may also be time to come to the grips with the fact that Stanislaus County might be approaching a saturation point in its COVID-19 vaccination efforts. COVID-19 vaccines have been available to the public since December of 2020. And as we all know, the push to educate and encourage people to get the vaccines has been on every media format known to man. You can't watch TV or listen to the radio or be on Facebook or anything without seeing a commercial for Get Your Vaccine. It's been a nonstop campaign. There's no shortage of vaccines, and now 9 months later, we feel that most everyone who desires the vaccine has had ample opportunity to get it. 63% of Stanislaus County has been either partially or fully vaccinated, and the other 37%, if they haven't had it yet, they probably aren't going to get it. No amount of bullying, coercion, or manipulation is going to change their minds. So I don't believe it's warranted to spend additional resources from the county in order to increase the amount of pro-vaccination messaging that goes out over the media. Are there other options? And so I was very happy to hear the question of public health about what can we do for those patients. And we've been doing a lot of research, looked at scientific studies and publications, and found there are other options available, much like a kit, like you mentioned. So considering these options, we want to ask other questions in addition to Mr. Padrizio's question about vaccination. We think the better questions are, what can we do to improve the overall health and wellness of the people in our county? What measures can we recommend to both the vaccinated and the unvaccinated to help them prepare for the predicted severe COVID-19 flu season this winter? How can we help reduce the incidences of viral illnesses, hospital admissions, ICU admissions, reduce the number of deaths as a result of COVID-19? And can we save lives through early intervention and treatment, rather than wait until they're so sick when they come to the hospital that they can't make it? So we believe the answers to these questions lie in community education, providing relevant information regarding these other options, and placing the overall health of our communities above any politics, narratives, or financially driven agendas. With health and well-being of our local communities in mind, we want to share with you a preliminary draft of the brochure. So this is just kind of a rough draft, the one that we've given to you. And we've created, it contains some but not all information on how to prevent viral infections such as COVID-19 and the flu, how to manage early COVID-19 symptoms with at-home treatments if infection occurs, and when to seek medical care if needed. We think the recommendations found in this brochure, if followed, will reduce the number of cases and deaths in our communities, and the overall health of our people will actually improve. So I'm going to have Ashley come up and review the brochure with you and answer any questions that you might have.
Okay, thanks, Laura.
Thank you.
Ashley. Good morning, how are you?
I'm good, how are you?
Good, thank you.
So I just want to start by saying that all the questions that you were asking public health was just like tugging at our heartstrings. We all have a similar goal, and that's to help keep our community safe. I just want to circle back to what Laura was saying. This wait-and-see approach is an extreme medical failure. The community comes to us and puts their lives in our hands, hoping that we're doing everything that we can to keep them safe, and we're failing them. People come in multiple times asking for our help, and we send them home and say, come back when you can't breathe. I work in the emergency department. I give discharge paperwork all day long, and we tell people there is no treatment for you. Come back if you become short of breath. And at many points, that is too late. And people are fearful to come back because they're afraid that we're going to intubate them. And the media has done a very good job at scaring people, and that is in fact the case. A lot of people come back at the point of no return, and we have to, we have no choice but to intubate them. So if you open the brochure, I'll go over it with you. I'm just going to kind of read it over quickly. So what conditions place you at high risk of severe symptoms if you contract COVID-19? Emerging data shows that patients who experience severe/fatal outcomes of COVID-19 have the following comorbidities: obesity being the most prevalent across all age groups, followed by hypertension, diabetes, cardiovascular disease, and respiratory disease. Individuals who are taking immunosuppressants or who are otherwise immunosuppressed should be considered high risk as well. Although COVID-19 affects people of all ages, a study at Mayo Clinic stated those who are 85 years or older are at highest risk for severe symptoms. And about 80% of deaths that occur in the United States are people that are over the age of 65. Risks are even higher for older populations that have other health conditions. Best practice infection prevention methods: first and foremost, as always, before COVID, you should stay home if you are sick, but do not be afraid to come to the hospital if you're concerned about your health. Do not wait to come in if you are feeling short of breath. As always, hand hygiene is the best way to prevent the spread of any virus. Washing your hands with soap and water is best practice. However, if soap and water is not available, hand sanitizer is recommended. Cover your cough and your sneezes. Nutrition. Proper nutrition boosts the body's immune system. Consuming fruits and vegetables that contain vitamin C and also protein helps heal the body. Fresh air and activity. We tell people go home and get rest, but the body needs vitamin D and you should not just lay around. Movement is required to keep the blood circulating properly, which helps prevent blood clots that you are at risk for with COVID-19. Also, pneumonia. Hydration. Fluids flush toxins out of the body and help transport nutrients into our cells. So we wanted to also tell people what the supplements are used for and not just say you should take vitamin D, zinc, vitamin C, melatonin, but explain what they do in the body. Vitamin C is an antiviral and antibacterial supplement that has long been promoted as a key player in immune health function. Zinc is vital for immune system function, whether it's improving the immune cell function or help reducing the ability for viruses to multiply. But for zinc to get into the cell, you need an ionophore, which is quercetin. It's a natural ionophore and one of the most abundant antioxidants. Vitamin D deficiencies are seen considerably more in COVID-positive patients versus non-COVID patients. And melatonin is an anti-inflammatory and antioxidant. If you look on the right side of the brochure, it has prophylaxis of all of those supplements and how much you should be taking for low risk and for high risk. It's not just a prophylaxis, it's also an early treatment option. People should continue taking these if they develop COVID. If you flip the brochure over, the at-home treatment and recovery, if you feel that you are developing symptoms of COVID-19, in addition to these recommended over-the-counter supplements and medications, a pulse oximeter is useful in helping monitor your oxygen saturation levels, which you can get at Amazon. We can give them in the ER. Also take ibuprofen and Tylenol unless contraindicated for fevers and body aches. As a nurse, I'm always asked, can I take these two medications together? Yes, you can take ibuprofen and Tylenol at the same time if the timing overlaps. Aspirin is also recommended to reduce your risk of blood clots unless contraindicated. I just want to add at the end, of course we do recommend monoclonal antibodies and antibiotics if there's any sign of pneumonia. However, it is out of my scope of practice to prescribe medication. So these are all common knowledge, over-the-counter medications that someone can take to help reduce their risk or the severity of their symptoms. Questions, comments?
Okay. No, that was great, Ashley. Very good. Thank you. Thank you very much. And Laura, thank you. And Deanna, thank you for public comments. Any other public comments? That's all that we have cards here for? Okay. Seeing none, we will move on to our consent calendar. Hopefully everybody's had a chance to review the consent calendar. Are there any questions with regard to the consent calendar? Anybody like to pull any items on consent? Okay. Oops, got my name moved. There we go. Thank you. Okay, seeing none. Anybody from the public would like to pull any item from consent? If there are none, I will look for a motion.
Motion to approve all consent items.
Second.
We have a motion and a second. All in favor?
Aye.
Opposed? Passed unanimously. Very good. Okay, we move on to our scheduled matters. We will now move into in-home supportive service public authority, and so I need to open this.
Yeah, close the Board of Supervisors.
Okay, I will close the Board of Supervisors meeting,
And open the in-home supportive services meeting.
and I will open the in-home supportive services meeting. And we will give everybody a chance to get set up here.
And I would like to make just a couple of introductory comments while our team is getting settled here. So we do have just a couple of items on our in-home supportive services public authority of Stanislaus County meeting, but I do want to recognize this is somewhat of a changing of the guard here, as Kathy Harwell, our longtime Community Services Agency Director, is retiring, and Amanda Sharp, our new Community Services Agency Director, is coming on board, necessitating this changeover. We do have a tradition and leadership here in Stanislaus County, and that is that we literally pass a baton when we have a change in leadership in these kind of key roles or any of our leadership roles. So before we're done today, I'm going to ask Kathy to go ahead and pass over the IHSS Public Authority baton over to Mandy. So.
Okay, very good. Welcome, Amanda.
Thank you.
And I guess we will call this meeting to order. We have our consent calendar, approval of the minutes from April 7th, 2020, and also approval to appoint Amanda Sharp as our new executive director. So we need a motion for the, to approve the consent calendar.
Motion.
And a motion
Second.
and a second. All in favor? Aye. Opposed? Passes unanimously. Okay, we will move on. Public comment, I guess. Do we have any public comment? Okay.
Okay, and before we adjourn, I did just want to thank Kathy for her tremendous years. I know we've already done a recognition with you here, and I want to welcome Mandy to the Public Authority and for your support of the IHSS program. This is as good as it gets when it comes to succession planning and being able to hand off leadership in Stanislaus County. So you may do the ceremonial passing of the baton and say any words you'd like.
All right. So again, I'd like to thank this board. It's just really been an honor to both be the director of the Community Services Agency and to serve as the second public authority director. And so I'd like to take this honor and this time to congratulate Mandy on her becoming the CSA director as well as the public authority director for Stanislaus County. Congratulations, Mandy, and I'm going to pass on this leadership role to you.
Thank you very much. I'm proud to be here, and I hope I can even get close to filling the shoes that Kathy has. Her great history, and she's been an excellent mentor for me before coming to the county, and also in the weeks here that I've started my position.
That's great. Mandy, thank you for many. We're looking forward to many great years from you and things in the future to come here, so we welcome you. And Kathy, you know, like I said, we did our recognition, but I just want to continue to say for, I don't know how many years I've been here, 11 years I've been here, you've been one of my go-to people for so many things. And I couldn't go along without you all the times that I've sent you these texts, whether they're late at night or in the middle of a meeting or trying to make phone calls to find you to try to get answers. And and we're going to miss you. Very much appreciate all that you've done. And so, anyway, thank you for everything.
It's been an honor. We can do that. My hand up? Sure, yeah. We didn't say you could make us sit. Make us dance.
Was it Shane?
Nico.
Nico?
Nico.
Yeah.
We'll pretend it's a race, and that's why you can take your mask off, because you're handing the baton off in the race.
Thank you.
Perfect. Thank you, guys. Okay. Very good. Thank you very much. Okay, we will now adjourn the IHSS meeting, and we will reconvene the Board of Supervisors meeting. Okay, we're going to take just 1 second here. Okay.
Take 2 minutes, I guess?
Let's take a 2-minute break here. Potentially what we can do with so many properties throughout there in the county that we're working on to identify and to try to do the same thing here. And I know Todd worked hard on this too, to legally to get us, because that's the hard part with this whole thing, is to get to the point where we can legally, thank God in this country we still have property rights. And so because of that, we can't just go in and take over somebody's property. We can't just go in and clean up their spots. And there's a reason for that, and it's a good reason, but still very frustrating for neighbors when you're in situations where you find these properties that are just sometimes have turned into hellholes, for no better word. And then we go through this process and get there, and then I'll let you guys take it from here. So, and this is what happens when we are successful.
Thank you, and good morning, Supervisors, County Council, CEO Hayes. Todd James with County Council's office, and I'm here with Lena Villa, who's the Code Enforcement Manager for the county. And we're just going to give you a brief update of this particular property in Turlock, 841 5th Street, and a quick overview of the receivership process, how we got to this point. A receivership under Health and Safety Code 17980.7 is basically a legal process through which possession to a specific real property is temporarily taken from the owner and placed with a court-appointed receiver. The receiver, under the supervision and direction of the Superior Court, borrows money against the property to abate emergency threats and bring the property into compliance with local and state codes. Receiverships are used primarily for severely substandard properties where the owner has a history of non-compliance with local enforcement agency orders, or where emergency circumstances are discovered that pose immediate threats to the health and safety of the occupants or the community. Some of the candidates for health and safety receiverships include hoarder properties, fire-damaged properties, abandoned structures, slumlord or absentee-owned properties, and properties with chronic code enforcement issues. Some of the typical scenarios where receivership may be appropriate are when the owner or occupants refuse to comply with the local enforcement agency's orders, and traditional code enforcement remedies have been exhausted. 2, the owner or occupants are unable to comply with the enforcement agency's orders due to physical or psychological limitations. And 3, the enforcement agency is unable to locate the owners. This would include deceased owners, abandoned properties, or absentee property owners. The receivership process begins with providing a notice to abate substandard conditions pursuant to Health and Safety Code 17986 and a 72-hour notice of intent to file a petition. If the conditions aren't abated, the county then files a petition in Superior Court for an order to abate the substandard property and appoint a receiver. Once appointed, the receiver is given the authority to take emergency measures to secure the property, immediately relocate any tenants or owners to safe and temporary housing if necessary, and to abate the circumstances posing immediate threats to health and safety. To do this, the receiver borrows money against the property to fund the abatement efforts and bring the property back into compliance. The monies borrowed by the receiver are given a super priority lien status. And once the property has been rehabilitated, it is typically placed for sale, or if occupied, you could also have a situation where the owner chooses to stay in the property. Generally, the timeline for a receivership, depending on the nature and extent of the issues or violations, is 3 to 6 months. That depends on the scope of the project. The county's costs of enforcement and reasonable attorney's fees may also be recoverable at the close of the receivership, subject to the court's orders. And with that, I will hand it over to Lane to discuss a little bit more in detail about this particular case in Turlock.
Good morning. So the case we have in Turlock is located 841 5th Street. It was first complaint received back in June of 2018. Board of Supervisors declared it a nuisance in April of 2019. The property owner wasn't able to abate it, and we couldn't be able to get a contractor at the time from the county to do the abatement for the massive area that needed to be cleaned up. We then switched to a new plan at that time, was to wait for the property to be sold at the tax auction. It was a few months away from going to the auction, so we were saying we're going to try to go ahead and go to the tax auction on this. During that process, when we did that, one of the heirs back out of the state decided to pay the taxes, and so they paid it in full, but that person was unresponsible and couldn't take care of the property. And so contacted us and said, I'm sorry, I can't take care of the property. Was in a care home and was at that point not being able to do that. So during that time, it became a bigger nuisance. Vagrants were at the property. More debris was brought. Neighbors were complaining of people that were living inside the house and in the backyard. So in July of 2020, we authorized a county council to pursue this receivership. It was something new we tried to do here to change and to address the properties as we could, to try to get further compliance. So the receivership process began by posting notices. We went out to post, talked to an attorney that was involved with the heirs, and they all agreed on getting this property taken care of. County Council filed then a petition to abate substandard building and nominated Jones and Mayer as a receiver. They've done a lot of properties in Northern California, and there's a lot of experience with these, and were able to come in. The rehabilitation of the property was completed in July. Most of the stuff was done, and in August they did some landscaping and some minor touch-ups to the property. So they finished it in good time. So we'll kind of show you some of the before and afters of this property. Obviously the before is on the left of what we have. must also say there was 4 fires at this location that occurred. Fire department was very involved and did a great job trying to save most of the surrounding properties. And I myself, when I was out posting one of them, there was a fire that started inside that I actually put out myself while I was posting the property. So it was kind of interesting on that. Here's a side of the side of the property. As you notice, some of the stuff you can see there is after they put a new driveway in, but they were living in this property and actually had an actual false fence in the front to just stay under the carport in the rainy season. So they used the carport and the outside, and they were cooking and doing fireplaces outside that area. Part of the receivership is in all the windows. We put in brand new windows through the whole property because every window was broken and unsecured along the front door. This is the rear of the property. As you can see, most of the fire that had occurred, there were tents in the backyard, a lot of just stuff thrown all through the property. And here's a cleanup of the property at the end with new fences put in. As you see the fences on the other side, the property owners on both sides had to go through their insurance companies through the last fire that occurred to get the fences installed. They did that themselves. There was one detached garage that was destroyed and another shed on the other neighboring property that was destroyed also. Here's furthermore in the backyard of all the vegetation that was around. So there was plenty of trees that were back there that they had a lot of shade to use their to stay outside, and more encampments that were involved. Here's the after picture of the whole backyard. As you see, it's a huge backyard. There's also, the second picture on the right shows the aerial of the area. Part of the contractor we talked to for the receivership that they wanted to leave the backyard in this state. They would normally put more in the backyard, but with the new ADU areas that we're trying to figure out to say, can we add another house in the back as part of the investment, whoever wants to come and buy this. So we left that option for the ADU process to happen in case we want to have accessory dwelling in the backyard. It's large enough to do such items to be done. Some interior photos here. There was that hole that's in the floor was actually being used by the vagrants to hide from the local sheriff when they showed up to clear out the house. When the neighbors called in, people would crawl under the house. They had some metal bedding and stuff that they would pull over that hole so that the sheriff wouldn't look at it. They would just walk through. And then we finished up the room. The kitchen was non-existent. Everything was torn out. They installed the new kitchen. Bathroom itself, same situation, one bathroom, so they fixed it up. And so that's really on the photos they have. So our recommendation is to accept an update on the receivership process for the property located at 841 5th Street in Turlock. And just want to know if there's any other questions.
Very good. Any questions for Lane or Todd?
I just got one.
Go ahead.
Thank you, Mr. Chairman. Todd, Lane, thank you for your report. How many properties do we have like this in Stanislaus County that are going through this process?
Through this process, we only have one currently that we're working on another one. So we're trying to go to county council to bring these properties to them to decide which ones we can actually bring forth in this process. We like to go ahead and try to do every aspect we can possibly do before we get to this measure itself, due to the time frames that the county council has to be involved in it. And so, like I said, we wanted to do this. This is really one of our pilot programs to show the Board of Supervisors what we can do with this and try to get direction to see if this is something you would like us to do on other properties in the county.
Absolutely.
Thanks, Buck. Any other questions?
How often do we update this process? Is on kind of a needs basis or at our discretion?
Yes, that will be what we're going to look at is whatever we bring forward on it. We'll investigate a case and say if you think this is something we would look into. We want to look at the case history, what we have, and then we will bring it forth once again to discussion to see what we can do on this and bring it forward.
Okay, and I do want to personally thank you, Lane, for all your hard work. I know my office has corresponded with you quite frequently, and so I do want to thank you, and you do a great job.
Thank you. Thank you.
Very good. Again, thanks, Lane and Todd. So we have, for you guys, we've been working on this. This one in particular, but we've got a list that we've been working on. We've been meeting, it's been quarterly or monthly, kind of going over the list with Tom, and there were properties like this. I'd like to go back to that picture. Just go back to the first one that was before and after, the front yard. And so we have been looking at all the properties. Yeah, probably that one right there. I mean, just look at that. And so this is all across the county. We've got properties, unfortunately, that kind of look like the one on the left. And there's opportunities all over for us. Vito and I went out to this after you guys had finished this all. We appreciate you showing what's been done there. And I very much appreciate, again, this list that we have that we're trying to go through and find all these properties in the county that look like this that we can turn into what it looks like afterwards. Again, within the letter of the law. And I know Tom and Todd and Lane, everybody's been working very hard to try to figure out how to do this. Some of it's receivership. We've talked about condemnation in some situations to try to figure out a way to do this. We've got the Housing Authority kind of as a part of this too. Barbara Kaus is looking at potentially when we find some of these properties where we actually end up condemning, if we get to that point, that the Housing Authority is ready, waiting and willing to bring in these modular homes onto these properties, onto these lots, especially when they're lots, burned out houses that can just be bulldozed. And we can bring these houses in, these modular houses in. The Housing Authority then can manage the property. They'll take care of the landscaping. And just think of the neighbors that live next to this before and after, and what we've done to improve the property values of that neighborhood. The people just living just right next door. I mean, it's a godsend for them, to see this happen. And I'm sure their values and their properties have gone up significantly since this has happened. So anyway, there's a lot of stuff that we can do here, and I very much appreciate you guys working on it. This is a great example to show, and the sky is the limit, if we can go throughout the county. We've all got these in our districts, that we're dealing with, and it's so hard to talk to the neighbors and tell them, geez, we're doing all we can, and they're having to live with this, or their kids living next to it and stuff. But we are making progress, and we're getting very creative, and it's because of you guys and what you're doing, and Tom, and we appreciate very much you guys' efforts here.
Quick question. Yeah, once again, this is amazing. I mean, the before and after just shows, like Supervisor Withrow just said, the difference it makes in a neighborhood. So what's the long-term, once the Housing Authority, then they just maintain, and then the owners now out of the picture since they got all the back fees, I'm assuming, for all this? Or, well, what's the process once receivership happens? And then, I mean, do we try to maximize rents? Because that is a big yard. You could probably put an ADU on it.
Right. Two different things, yeah.
Well, in this case, we had the owner was deceased, and the potential heirs were not showing any interest in taking care of the property. So basically, the receiver borrows money against the property, okay, and at the close of the receivership, those funds, the house is sold, and those funds are used to pay back for the rehabilitation efforts. But whatever's left over, as far as equity in the property, would revert back to, in this case, the estate.
And that's, I was going to say, Todd, that's the receivership mode. And the other one that maybe you're talking about, Manny, is a condemnation mode, which we're looking into, a little more difficult. But
yeah. Todd, not all properties that we have on our list are candidates for receivership. Can you talk about some of those properties that are not candidates for receivership?
Well, when you're evaluating a property for receivership, some of the things that might prevent you from going in that direction are if there are significant tax encumbrances on the property that would make it just not feasible to be able to borrow sufficient funds to rehabilitate the property. Possibly it could be a property where you look at the valuation post rehabilitation, it just the funds you wouldn't be able to borrow enough to complete those rehabilitation efforts. But for the most part, this is actually a tool that can be used in, I would say, a lot of different circumstances. Just because the property is encumbered doesn't necessarily mean that we can't, take action on it through receivership, because the receiver is given a super priority lien at the end of the case. Some other properties where This wouldn't be an option if it's say a vacant lot that has, code enforcement problems and we can't, are unable to act on that. Because for receiverships, this applies primarily to buildings.
Residences.
Yeah, substandard buildings, so it's not necessarily an option you could use on a vacant lot. There are other mechanisms that we could use on vacant lots, I think under Business Professions Code, where you might be able to get a receivership under certain actions that you could bring under that code section. So
Yeah, and so Manny, those are the properties that we're trying to put together a program to address. If we have a project and the project requires the acquisition of a nuisance property in order to build housing, that's the kind of project that we're trying to pull together. So pull together a project that encourages housing through our Stanislaus County Housing Authority, find those properties that are vacant, that are not candidates for the receivership process, attempt to acquire them through negotiation. If that fails, then perhaps we would use condemnation. It's a very tricky little area, and it's taking us a while to kind of pull it together, but we hope to soon be able to bring that to the board for approval.
So yeah, it would become two different, I mean, yeah, one's kind of involuntary, right? Condemnation would be involuntary, where the county would go and say, you're not fixing it up, it's becoming a nuisance, and we need to take this away from you. And then receivership's more like unfortunate situations like those.
Yes.
And in those condemnation situations, we've got ones where we have landowners when it's a lot, for example. I can think of one in particular that we've been dealing with for years, that they just won't respond. We just can't get them to respond to letters, to anything, and the lot just sits there, they don't pay their taxes, or sometimes they do, but they don't pay their taxes, it sits there and they just won't do anything.
But on the taxes one, don't we have that every 5 year, if you're back on taxes, it goes out to the open market for sale?
Yes, if they don't pay their taxes, then it goes out on the open market, and there is some ability to for a city or a county or another public entity to obtain that property off of that off the tax rolls and to do something with it, such as housing.
All right, good stuff.
Very good stuff, yes. So thank you guys very much for the update on this, and we look forward to more. Thank you. Great work.
Thank you.
Okay. We will move on now to item, I'm sorry, do we have to do a vote on this? Okay, so we need a vote to accept this update, sorry.
I move to approve.
We have a motion.
Second.
We have a second, all in favor?
Aye.
Aye, opposed, passed unanimously. Okay, you're clear to go. Thanks, guys. Okay, let's move on to item 9.2, acceptance of an update on the Stan Connect mobile application, a customer relationship management system. Amy, good morning, how are you? Good morning.
All right. Well, good morning, Board of Supervisors, CEO Hayes, County Council Bose, Amy Collier-Carroll, Director of Legislative Affairs and Communications, and I'm here this morning with Martin Barajas, our application specialist from ITT, who's been a critical partner in this process. He's here to present with me this morning. In alignment with our board priority around delivery of efficient public services and infrastructure, we have an exciting development to present this morning, the Stan Connect mobile app. This handy tool connects residents with our county government. But what does it do? A CRM, or customer relation management tool, improves the customer experience and offers residents the opportunity to interact with government through a convenient virtual interface that saves time. A recent study from PR Newswire indicated that interactive messaging and immediate communication are desired by the vast majority of U.S. consumers who use smartphones. Many people prefer to do business this way versus calling a department or perhaps visiting an office in person, especially in the current times. In the past year and a half, we've spent a considerable amount of time cleaning up our CRM, which is accessible through the website, stancounty.com. And we've built out a custom-designed mobile app called Stan Connect that makes finding information and submitting requests very easy. You can see from the app home screen that there are 7 primary functions, what we call applets, available right there on the home screen. You can start a request, access a list of commonly used online county services, view all county departments, our homepage newsfeed, find your district representative from the Board of Supervisors page, view employment opportunities, and access our social media feeds to stay informed. What's new? Well, Stanislaus County began using the Go Request app as the primary government services request platform in 2006. The Go Request app had limited functionality and was only accessible through a database of government services apps beneath the Go Request menu of agencies. The Go Request app was developed especially for cities and counties and has been an effective tool in allowing residents to submit requests and report issues, but as you can see by the home screen there, it did not allow for much outside of those basic services. Our new app is specifically designed to meet the needs of residents in our county, offers greater functionality, and has been available in the iPhone and Google Play app stores since July. As a matter of fact, if you had the old Go Request app and you open it today, users will be directed to download the new Stan Connect app. So how is it used? Well, the app is very easy. It allows residents to efficiently enter and track service requests online any time of day. There is a simple Start Request button at the top of the app's home screen. This is perhaps the easiest way to request service in the county. Users can upload up to 5 images with their entry, helping to identify the need for service. When a request is entered into the system, the software automatically routes the request to the appropriate individual within the organization. An employee representing that department will address the request, and the employee within the department that will address the request is notified via email. Each request is pre-assigned an expected close date, which is provided to the requesting resident via email. The resident is notified via email as well when the project is completed. Although app users must register to submit and track their requests, submissions can be made anonymously. Anonymous users, however, will not receive email confirmation or notification of completion. It is very simple for customers. For county departments, the system greatly assists with managing requests. Each department has responsible parties assigned as users in the Stan Connect system, providing an efficiently organized workflow to triage requests. An employee who receives a request can reassign it to another employee or department in the system and reroute the request if it was entered incorrectly and sent to the wrong department. The most common requests, as you can see listed here before you, are illegal dumping, as that remains a primary concern of residents, along with tagging or graffiti and street repair needs. Just for your information, there were 655 requests submitted this month, 7,565 year-to-date, and 127,975 all-time requests since 2006. The app works in partnership with our customer center on the website, which residents may also use to submit and track service requests from their home computers with convenience. You can see the website CRM button that lives on the left-hand side of our website embedded on all pages. This interface is also easy to use to submit concerns or service requests as an alternative for residents who aren't on mobile devices. However, we know a lot of our customers like getting things done directly from smartphones. The new Stan Connect mobile app was designed for use by Android or iPhone users, and we're very excited about it. We want to close with a sneak peek of our new outreach video.
Hey Stanislaus residents, you can stay connected with the all-new Stan Connect mobile app. If you live in Stanislaus County, you should download the Stan Connect app. It's the most convenient way to connect our residents with county services and elected officials. With Stan Connect, you can access news, job opportunities, and public information, or use the app to submit concerns and make requests for service right from your smartphone. Want to save time and skip a visit to county offices? Just download the Stan Connect app on iOS or Android. The convenient tool provides residents direct access to all county departments, the Board of Supervisors, county job openings, property tax and vital records, voting information, find pets for adoption, public health clinics, and community resources easily from your phone. Spot some trash that needs to be cleaned up, a pet on the loose, or a pothole that needs to be filled in the county? You can report all of that through the app too. The Stan Connect mobile app is an all-in-one tool we can use to stay connected, access services, and help keep Stanislaus County clean. Search the App Store for the Stan Connect app. Click download and get connected today. Hey Stanislaus residents.
You thought you might want to watch that 2 or 3 times since it was so good the first time. So that's kind of a sneak peek preview of the Stan Connect mobile app. We'll be starting to push it out on all kinds of platforms and sharing it broadly in our community. We have some rack cards and flyers available on the way out for anyone who's here. And if there are no questions, I'd ask that the Board of Supervisors accept this update on the Stan Connect mobile application.
Very good. Questions?
Thank you, Mr. Chairman. Thank you so much for your presentation, and I think it's great that we're increasing and improving accessibility between our local municipality and the constituents. I did have a question in regards to when an illegal dump is reported through the app, and let's say that illegal dump or the graffiti abatement is not in a county jurisdiction. What is the process in then getting it to the right municipality, whether it be the city of Modesto or city of Ceres, thereafter? Are we, I guess, moving the ball over to the other municipality?
Do you want to
So typically if, so on the app itself, when a customer submits a request, it's got a map with certain boundaries depicted. If the area is within a city limit, then the customer is notified you're out of bounds, for example. The customer can still submit the request, and upon the appropriate department receiving that request, they can check for the address that was submitted and verify whether or not it was within the boundaries. And then that employee would then respond to the customer with the appropriate information.
Okay, but we're not just, our employees aren't just telling them, I'm sorry, this is not our responsibility, this is the city of Modesto. I guess we're coordinating with the other city, whether it's Ceres, Modesto, or Patterson, wherever it may be, that, hey, just wanted you to know we received this on our app, it's not in our jurisdiction, but it is in yours, and we wanted to notify you of it.
Some of the departments are forwarding those requests over to some of the municipalities.
Okay.
Because each department handles their own section of the system. So some departments may provide the employee with the appropriate information on who to reach out to, depending on the request.
Okay. Well, thank you very much.
So I heard very clearly, we want them forwarded. So I think the directive to the departments is to have them forwarded. Supervisor Graywell?
Yes. Thank you, and thank you for the presentation. Exciting stuff. Wanted to know, so Go Request, is it going to redirect requests for right now, since it's going to probably take us some time to get this out to everybody that this is available? So our request.
You mean the users of the prior app?
The prior app.
So we did talk to our developer about pushing a notification to those people to let them know we have a new app for them to download, but that wasn't possible in the workflow that we had. So the system right now, if you open your Go Request app, it says, the only functionality built into the app is go to the App Store and download the Stan Connect app. So they can't use the app that they downloaded in the past, but they will get instruction to download the new one when they open the app. Hopefully that makes sense.
Yeah, so it'll just be, they click on Go Request when it says Go Connect.
It says Stan Connect, yeah, download the Stan Connect app.
It says upgrade app when you pull it up.
I just did it on my phone. It tells you to upgrade.
Perfect. Well, that's good, because that's been out there for a long time. That would be all right. Perfect. Well, exciting stuff. I always felt that the Go Modesto app was a little bit new and fresh, because we just did that update a little bit, and now it's nice to see the counties also got a fresh app that everybody's more user-friendly. Thank you.
Thank you.
Perfect. Supervisor Condon?
I'm good.
I just want to thank Amy and Martin. Thank you guys very much. Good presentation and good job. I know this has been something you've been working on, so very good. Thank you.
Thank you.
And the other thing I got to mention, did you notice how smooth the transition of power happens here in Stanislaus County? I mean, it's just seamless is the way that works.
I guess that what he's saying is to let the record show that I returned. Vito's returned. Thank you.
Vito's back.
So I love it is more user-friendly, no doubt. I know I walked in halfway through because the vast majority of the issues are going to be just regular requests or road, garbage, pretty much what we went over, graffiti abatement. So it's much easier to find it before you had to go find a department. We know what the departments are, but the public, listening public typically doesn't. So we think it's excellent. We just need to push this out, including ourselves. We need to make sure in post that this can save you a phone call. It gives you GIS coordinates. Obviously, you take a picture. It gives a good indication. So perfect. All right. If there's no other, I'm going to go out to the public. No other questions? Anyone from the public want to comment on this? Seeing none, I'll bring it back to the board.
Make a motion to accept.
Motion to accept.
Second.
And we have a second. I just want to acknowledge we didn't have any written comment on this from the public, correct? All right. So all those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Thank you. On to correspondence.
Thank you, Mark.
This board has received a notice from the Wesley Community Services District regarding a vacancy on their board of directors.
Refer to the clerk, recorder, and registrar of voters.
This board has received the claims as noted on the agenda.
Acknowledge receipt of claims and refer to the chief executive office. Are there any board of supervisor reports?
I just want to thank Deanna for sticking through the whole meeting. So many times we have people that come and make a comment and walk out, but I really appreciate, we all appreciate when somebody stays through the whole meeting and takes part of your day here. So thank you for being here.
Same to Steve.
Same for Steve. I'm sorry, yeah, also.
Very good. Legislative fiscal management report, CEO.
Just a couple of quick items for you this morning. So I think most people are tracking that Governor Gavin Newsom has signed Assembly Bill 37, which requires county elections officials to move to a vote-by-mail process across the state, sending a ballot to every active registered voter for all elections, whether or not it was requested. So voters can still choose to vote at a physical voting center if they prefer. That information will definitely be out there, and we'll be educating the public on these new changes. We should also note that the law also permanently extends the time vote-by-mail ballots have to arrive at elections offices from 3 days to 7 days, which was a practice adopted in 2020 as a result of COVID-19. So big shifts in terms of how elections will be conducted going forward. Also just want to mention that later this week we'll be meeting with our Federal Economic Development Administration about our request for grant funding to support water infrastructure development at the Crows Landing Industrial Business Park site. So we're going to brief with EDA to learn a little bit more about our prior grant request and hopefully position us better going forward to receive some support from EDA. That concludes my report.
Jody?
Yes, sir.
SB 9, SB 10, do you have any information on those?
I do not. There are so many bills out there. I couldn't. Could you give me a little hint on which one that was?
I have, the governor has over 500 bills on his desk, and SB 8, SB 9, and SB 10 all have to do with affordable housing and housing in general in the state. I have some specific information for you as to SB 9, the so-called end of residential zoning bill, and SB 10, which is kind of a companion to that. If you'd like, I can update you on that individually, or I can send a memo to the board, whatever your preference is.
That's fine, whatever's easiest.
Yeah, and thank you for the prompt. I actually be happy to also tag team with Tom on this one because, yeah, we are tracking and we're very familiar with that. And I want to acknowledge our planning director, Angela Paredes, has already looped us in on the interpretations of the legislation from a planning perspective. So we are very familiar with it, but definitely not familiar enough that I would want to try to cite it publicly right now.
Yeah,
So
okay.
we'll get you information offline.
Thank you.
Okay. We do have a closed session.
Yes, we have closed session this morning. We have one item, conference with legal counsel, anticipated litigation pursuant to Government Code Section 54956.9, subdivision D4. There's one matter there. We do not expect a report out on that.
Okay.
Public comment?
Anyone for public comment on the item? Seeing none, this meeting is adjourned to closed session.